Hello, I'm Dr. Chris Inman. I run the Masters in Advanced Healthcare programme. Within the Masters in Advanced Healthcare course, there are 3 different named awards. The first one is the Postgraduate Certificate, which involves studying 4 modules, and you get your credits for that. If you want to continue, you can go on and do the Postgraduate Diploma, which involves studying another 4 modules, so you'll have studied 8 in total, and you'll be entitled to a Postgraduate Diploma in Advanced Healthcare. Students who want to continue after that do the Masters Award. That is an MSc dissertation, a research project, and it can involve looking at clinical leadership or systematic reviews or carrying out primary research. There are 3 different award advanced healthcare titles. The first one is an Advanced Healthcare, an open award, which any health professionals can apply for. So that is doctors, nurses, midwives, allied health professionals such as physiotherapists, speech and language therapists, dietitians, etc. So anybody can apply for the open award. The second one is a nursing award, which only nurses can apply for, and the third one is an Advanced Healthcare Midwifery Award. However, the nurses and the midwives could apply for the open award if they preferred that. Career prospects are very good with a master's degree, and it is internationally recognised. The UK currency points are transferable to the EU and internationally. And so the students can get their awards and take them to other countries for their career development. And now I'll hand you over to my colleague Joy Hall, who'll provide details about the modules.
Hello, my name's Joy Hall. I'm Head of Department for Public Health here at Birmingham City University. And today I'd like to introduce you to the MSc in Advanced Healthcare programme. The MSc in Advanced Healthcare has been developed specifically for senior members of nursing and midwifery staff, along with their senior colleagues in the allied health professions, such as physiotherapists, speech and language therapists and paramedics. The programme really aims to facilitate advanced learning in these very senior members of staff. Unlike the MSc in Advanced Practice, there is not a practice element to the programme. The programme is built in such a way as to look at the core elements and core concepts in advanced healthcare, both in the UK and also overseas for an international market, recognising that healthcare systems globally are very different from those present in the UK. Therefore, the modules which constitute the programme, which are 8 in total, really focus on those core elements of nursing practice, midwifery practice and general healthcare practice that senior members of staff are likely to benefit from in terms of advancing their own practice and advancing their own roles. The first module is entitled Leadership in Advanced Healthcare. This module really focuses on that crucial leadership role that senior members of staff undertake in any healthcare system. We look very briefly and very much in depth at all of the concepts around clinical leadership and clinical management, and really underpin this with the individual practitioner's practice. The next module that you'll be studying in conjunction with the leadership module is entitled Equity and Inclusiveness in Healthcare. This module really focuses on the sort of multicultural issues and the diversity of cultural and multicultural backgrounds that our clients and patients come from. It facilitates the learning within the advanced practitioner of these elements of their practice. Facilitating learning in healthcare is the next module of study. This really recognises the key important role of teaching and learning that the advanced practitioner or senior practitioner undertakes in their everyday role. It's long been recognised that healthcare practitioners undertake an educative role with their patients, colleagues and other members of staff. This module really equips the individual practitioner to undertake this role with the appropriate theoretical underpinning for their practice. A further module of study is entitled Economic and Policy Influences on Healthcare. In this module, we really look at the policy drivers which underpin healthcare systems, both in the UK and also on the international environment. For those students who are studying from abroad, we specifically ask them to start to focus on the individual policy and economic drivers which influence the healthcare system in their own home country. The next module of study starts you focusing on the research process. The title of the module is Research Theory and Practice, Quantitative and Qualitative Methodologies. In this module, we really start to prepare you for your master's dissertation project, looking at the quantitative and qualitative elements of the research processes and research designs. We now turn our attention to the more practice-specific modules. The first of these is entitled Nursing Care of Patients or Individuals with Long-Term Conditions. It has long been recognised, or it has been increasingly recognised globally, that long-term conditions such as diabetes are becoming an increasing problem for healthcare systems to manage. This module focuses on the care and management of the individuals and their families who have problems with these types of conditions. Another element of nursing practice and healthcare practice which has been long recognised is management of pain. Nurses and healthcare practitioners really encounter pain in a variety of different clinical and community settings. This module aims to look at, in depth, the management of pain of individuals really from cradle to grave. The final clinical module in the Nursing and Allied Health Professionals pathway revolves around the notion of infection prevention and control. It's been long recognised and increasingly recognised both in the UK and globally that healthcare professionals have a crucial part to play in the prevention of the spread of infections, particularly in the community and essentially within a hospital environment. This module seeks to empower those practitioners to really take a lead in the prevention of the spread of infections in the community and a hospital setting. The final component of the MSc in Advanced Healthcare is the Master's Project. In this, we've moved away from the more traditional MSc dissertation to give the students more variety of assessment options. The first option is the traditional MSc dissertation, where the student can undertake a traditional piece of original research. The second option is undertaking a management project, and the third option is looking at undertaking a systematic review of the research and evidence base around a specific student's chosen topic. I'm now going to hand you over to my colleague Anne Kingsott, who will describe the MSc in Advanced Practice midwifery route.
My name's Anne Kingsott. I'm the Head of Department for Midwifery and the Lead Midwife for Education within the university. The department is responsible for the 2 midwifery modules that you'll undertake as part of your programme. The first module is a double module and it looks at the challenges and influences on midwifery care. The second module is the Advanced Midwifery Care, which is a single module. Both of the modules work together to look at the positive impacts on women's health and midwifery, as well as looking at the role of professionals in taking midwifery forward into the next century. The first module you'll study is a double module called Influences and Challenges on Midwifery Care. This module is designed to look at the role and influence of women within society and the factors that influence their health and well-being and public health issues. The second module you'll study is called Advanced Midwifery Care and is a single module. This looks at the role of the midwife in contemporary practice and the roles and influences on women and their beliefs in being able to give birth normally.
That concludes the sort of overview of the MSc in Advanced Healthcare for nurses, midwives and allied health professionals. If you would like further information about any of these routes and the programme in general, please contact Dr. Chris Inman, who will be very happy to help you.